Good morning, I'm Dr.Deepak Subramanian, clinical lead and senior consultant in the Department of Minimal Access, GI and Bariatric Surgery at MGM Healthcare, Chennai. Today I'm here to talk to you a little bit about hernias, a topic which many people do not understand, a topic which is always a myth surrounding it. Hernia is basically a protrusion of intra-abdominal organs through a weakness anywhere in the abdominal wall. Most commonly in males, we see it in the groin. In females, we see it around the belly button or the umbilicus or in previously operated scars. How does one identify that they have a hernia? Generally, hernias, unless when they become complicated, are symptomless, except that they may have a small bulge in the area where the herniation is occurring, and that bulge needs to be identified by the patient themselves. And unless these tips are known, patients do not know to identify these. So a small bulge which is painless, which may get bigger or aggravated while straining, while lifting weights, is something that may be the first earliest symptom of a hernia. Why hernia? What happens if you leave a hernia? Basically, these are intestines that come out through a small opening. And when this intestine comes out through the small opening for a prolonged period of time, they can lose its blood supply, the intestines can lose its blood supply, and that is a serious emergency called as strangulation. Which is why hernias, before they become complicated, have to be identified and the right solution and treatment needs to be given. By treatment, hernias, there are no medications for hernias. Surgery is the only treatment option that is available, but today we have extremely great minimal invasive laparoscopic methods for treatment of hernias, which basically makes the hernia surgery a daycare procedure wherein patients come in the morning, get it done, that evening they are ready to go home, and it's a completely painless procedure, very safe to do. Post-surgery, the only tip that we tell these patients or advice that we tell these patients is not to lift heavy weights for about a period of 6 to 8 weeks following surgery. Otherwise, they can do their routine normal activities, go back to work in the second post-operative day and lead a normal life like any other individual. When you identify a hernia, why should you get it operated at MGM Healthcare specifically? At MGM Healthcare, we have state-of-the-art operating theaters, finest precision technology, great laparoscopic equipment, and a great team of anesthetists and intensivists who can give you a completely pain-free anesthesia post-procedure as well. And these are slight things that can change the quality or the outcomes of these hernia patients. Because when a patient has pain, they are unable to move out of bed. Here, when you give it in a very minimal invasive method, as well as give good pain-free medications post-surgery, these patients are up and about and are walking at the end of the surgery. We limit the time duration that the surgery happens. We do a surgery which is probably required, which requires about an hour in less than that time, giving the same level of outcomes thanks to the great technology and the equipment that we have in MGM Healthcare. Thank you.